Go.
Hi, my name is Emilio. I'm a social worker here at Rochester General. The social issue that's going to be the subject of this interview is going to be homelessness and substance abuse. The client's name is Lori. She's a 21-year-old female. She was here 6 months ago receiving substance abuse treatment, and I'm going to be meeting with her now to discuss all these issues. Hi Lori, how you doing today?
I'm not doing so good.
Well, what's going on?
Well, I lost my job because I got caught doing coke while I was working, and since then I haven't paid my rent because I've been just doing more and more coke. So I got served with an eviction notice. Now I have no place to go, and my use of coke has gotten worse because I lost my job. I got more depressed, and then I got the eviction notice, and I got more depressed, and so then I would use more coke, and now I'm to the point where I'm using a lot of coke, and it's not even helping.
Okay. Well, before we get started, I want to just let you know, just to reinforce that it's the same as last time. Anything that you say and anything that we discuss in this room is held in strict confidence. So you don't have to worry about being afraid of anything getting out or being reported to anybody else. It's just between what we discuss here is between us, okay?
Yes, thank you.
So what I'm hearing you say is that you are doing more cocaine than you used to. It's becoming more of a problem for you for functioning. You are becoming evicted, and your depression is worsening. Is that correct?
Yeah.
Okay. Well, what I'd like to suggest is that since you're getting more depressed and your substance abuse is increasing, I'd like to suggest that we look into MICA treatment, which is a dual diagnosis treatment program for people that have substance abuse problems and mental health issues. But the first and foremost thing is that we have to address the issue of you possibly becoming homeless, okay? I think that I will get in touch with some temporary shelters, and I will also gather information regarding alternative housing. Have you ever thought about maybe going into like a supportive living apartment, or maybe to a halfway house first and then to a supportive living apartment? Have you ever thought about that?
No, but I think right now I definitely need some options.
Okay. Well then, what we'll definitely do is I'll get all the options together for you, and then we can discuss them and see which one would be a best fit for you. And then what I also will do for you is I will get you back into the group therapy for the substance abuse, and then I'll make the arrangements to see the therapist. And I will go with you for the first appointment to make sure you're comfortable to determine if the therapist is a good fit for you. And what I probably think is going to happen is that there's going to be a dual, you'll probably get a dual diagnosis, which will be substance abuse and mental health, which will be for depression. And then there's a specific treatment protocol for that. It's called MICA, Mental Illness Chemical Abuse Treatment. And what they do is they treat you for the chemical dependency with group therapy. You'll have an individual therapist, and you also see a psychiatrist to see if maybe medications are required. So what I will also do is get all this stuff ready for you, make all the referrals. And the other thing I want to bring up is that support groups have always been helpful for a lot of people. So I'm going to give you some information on support groups. I'm also going to give you a list of AA meetings. If you just go over those for next week when we meet, and then we'll discuss that also. Okay? How does that sound like a good plan?
Yeah, so I feel better.
Great. Okay. So I'm going to make the appointments and schedule everything, get the referrals done, and when we meet again next week, we're going to have our own appointment, and then I'll make the appointment right after our appointment for the therapist, so we can, get things rolling.
Great, thank you so much.
Thank you for coming in, and we're going to work on everything together. Okay?
Thank you.